Good morning, students. Today in this session we will be seeing about family oriented nursing. So one of the important concept of health for all is family oriented nursing. So if you want health for all, we are concentrating on another aspect of care, that is family oriented nursing. So by providing family oriented nursing, we are achieving health for all. So the family centered care, FCC, that we have seen already, we have seen in the major trends of nursing. It is a partnership approach to healthcare decision making between the family and healthcare provider, and FCC is considered as the standard of pediatric healthcare, and we know that it is it's an upcoming trend, or it is a modern trend of pediatric nursing care, family centered care. Now we'll see what are the other terms that we are using in relation to this family centered nursing. That is a partnership between the family and care provider. There is a collaborated approach between the family and care provider and families as experts, and we include the family members also in the decision making process. And each family has different background, thinking, style of living, customs and economical level. So while giving nursing care, we should keep in mind the background, the customs, their cultural habits and all. And while working with the families, the nurse should have scientific knowledge regarding family theory, structure and type of family, family life cycle, function and need of the family. So now we are moving further. We are going to see about the aim and concept of family oriented nursing. The aim is the overall welfare of the family, and the concept is that every person is a part of one type of family. So while giving nursing care to the family, we'll keep in mind the background of the family, the type of family and all. Next is the 10 principles you can see about the family health nursing. That is, first is we have to provide services without any discrimination. Without any discrimination like the economical level or the culture or background, without any discrimination we have to provide nursing care. And periodic and continuous appraisal and evaluation of family health situation. It is not like once we are giving care, that is we need to give a continuous care by periodical appraisal and evaluation, by frequent family visit and all. Then proper maintenance of record and reports. Whatever records or whatever health status of the family, that should be properly recorded. Then provide continuous services. Next is health education, guidance and supervision. That is the integral part of family health nursing. Next is we should maintain a good interpersonal relationship without the family. Then only we will get an access to provide care to the family. And plan and provide family health nursing with active participation of the family. That is very important. That is a partnership approach. We should have a proper a collaboration with the family. Next is services should be realistic in terms of resources available. It should be realistic, like whatever services are there, whatever resources are there with us, we are utilizing that particular resources. Next is encourage family to contribute towards community health. Okay, so while attaining the health of individual family members, we are attaining the health of the community. And active participation in making healthcare delivery system. So there are 3 approaches of family oriented nursing by Friedman, year 1992. First is family as context, family as client and family as system. Family as context, it is that the primary focus of the system is on health and develop individual within a context. So we are providing family care to the family in that particular context. And second is family as a client. We are taking care of the family, or we are considering the family, whole family, as a client. Next is family as system. That it is a mutual approach. That is, we are considering the family as a client as well as a context. Next is health risk families. So we are categorizing certain families in this particular health risk. That is developmental risk factors like growth and development, if any developmental delay for the particular children, and so that particular things like children with cerebral palsy, autism and all. Situational risk factors like unexpected event that happens in the family, like death or separation, like that. Next we can see hereditary factors like any hereditary diseases, lifestyle factors like behavior of family members like any addiction, economical factors. Next is identification of health risk families. We are identifying the families are in three particular classification: high health risk family, moderate health risk family and low health risk family. So while giving care to the families, we are giving priority care to the high health risk family. Then characteristics. So these are the characteristics of high health risk family. So while assessing this high risk family, we should keep in mind all these characteristics. Size is more than 6 members. So that is a big family. Age group: more than 3 children are under 6 years and 2 or more having old age problem. So 2 are elderly and more than 3 children are under 6 years. Immunization is incomplete. Mother is illiterate, pregnant, malnourished or anemic. Nutrition is undernutrition. Health attitude: they have negative attitude and they have poor hygiene. This is about the high risk family. Next is moderate health risk family. Size is up to 6 members. Age group: 2 to 3 children are under 6 years and 1 having old age problem. Immunization is incomplete. Mother status is illiterate, pregnant and lactating. Nutrition is medium. Health attitude is neutral. Hygiene: poor environmental sanitation and fair personal hygiene. Next is low health risk family. Size less than 5 members. Age group: less than 2 children are under 6 years and no old age problem. Complete immunization. Mother is literate, pregnant with good health. Nutrition is balanced. They have positive attitude towards health and they maintain good environmental sanitation and personal hygiene. So this is the these are the classification of high risk, moderate risk and low health risk families. Next is, so after assessing their risk, we are giving nursing process. So the definition is that it is an orderly, systematic step to assess the health need, plan and implement and evaluate the services to achieve health. So the family nursing process suggested by these authors consists of following steps and adapted specifically with family as the focus group. So here the family is the focus group. So we can see the steps. That is, the first is assessment of client's problem, like maybe hypertension or diabetes mellitus. Diagnosis of client response needs that nurse can deal with. So we are nursing diagnosis, planning of client's care, implementation of care and evaluation of the care. So these are the nursing process. Now we'll see what all qualities and she should have a family centered approach. She should provide holistic and non-judgmental approach. So while taking care of the family, we are giving a whole approach, whole care, holistic care. We are focusing on every aspect of the family, like physical, their physiological, their psychological, their spiritual, and every aspect we are taking care of. Then able to accept different values and beliefs. and able to work in adverse situation and identify problems. Adverse situation like in a disaster or like pandemics and all. And she should be flexible, sensitive and skillful. And the nurse should able to cope and manage stress. So these are the qualities of family health nurse. So in this session we have seen the definition, and we have seen different the families, the principles of and we have seen how we can identify or assess the health risk families and the nursing process. Okay, thank you.